What is it like working in a rural community? Well, I grew up in Huron and was born and raised, graduated high school here, and left like everybody does because you think the grass is always greener, bigger and better. And so I worked in Iowa for a while and in Nebraska, and when it was time to think about having a family, this is the place that I wanted to be, was in a town the size that I grew up. So I came back to my hometown, and it has been a great way to place to raise my children, and a great way to be connected to the community. I guess in a small town, that's the best thing, I think. And the other thing that I really like is if you come up with an idea, basically you can do it. The most rewarding part about working in Huron, I think, is the connectedness of the people. I know most everyone in town, and because of my position here in public relations at the hospital, most people know me, which has been really good raising children because my kids couldn't get away with anything. But it's also nice to be able to just pick up the phone or shoot an email and know the person on the other end of that communication personally, so that it's more likely that you can start the conversation out on a connected note and then be able to work together. One of the things that my friends who did move away and stay away are always surprised about is that pretty much I hang out with their parents. I'm on all kinds of boards with them, and I really enjoy it. It's very rewarding to be able to put our heads together and our hands together and get big things done.
I enjoy working in rural Huron because of all the friendly people I get to meet.
I enjoy working in the hospital the size of Huron in rural South Dakota because every day is different. I don't know if I'm coming in to a slow day, a crazy day. People I know all the time are coming through the doors because of our size of our town. So I've worked here for close to 30 years, so hard to have anybody come in that I don't know. So it's nice to see a friendly face.
I'm a nursing student and my coworkers are great helpers.
Hi, I like working in rural Huron because I work with everything from tiny babies through old people.
I like working at the Huron Regional Medical Center in a rural community because it is a small community, so everybody knows everybody, everybody's friendly, and all the doctors know us, we know all the nurses, so everybody works together great because it's all a small community and everybody's together and we all have to learn how to work together.
I love working in rural Huron because this is the community that I grew up in. I don't ever want to leave it. It's nice to work with your friends and family, and you get to know the patients and they become your family as well.
I love working in our rural communities and in particularly at HRMC because you not only work with your coworkers, but you become friend and family.
How has Huron adapted to the COVID-19 infections that's in our community? I'll just say that from the very beginning it hit our county hard. We had one of the first surges. Both the hospital and the county immediately started to adapt and had our HICS teams come up. So for the hospital, our main concern was how to have enough capacity. We had no awareness how big the first surge was going to be as it grew. So we immediately needed to expand our capacity to both to have enough ventilators and enough rooms. We needed to convert some regular med surge rooms to negative pressure rooms and exhaust out air. So we got teams together that expanded our capacity by 20%. With the addition also of of 6 more isolation rooms. So with the potential actually have 2 more after that. So a lot of preparation on the capacity side. Infection control is also the other big issue, how to have enough PPE and training. So how to recycle, a lot of early discussions on the practice of safety, how to keep our staff as safe as possible and not to become infected. Divided up our ER into 2 separate areas so that we could have naked pressure room there. So there's a lot of preparation. We also started the first collection site because the county was just getting going. So we used our ER driveway to collect and for the state to test for positives. Immediately we knew that we needed help. The county, Vito County, got their Hicks team going, and that paralleled. We were not a part of their team. We had a liaison there, but they immediately knew that they had as a mission several things. One was to protect the hospital from getting overrun with the surge. So anything that they could do locally, they went into action to do. So they started a call center so that the calls that could be for people needed to know about if they might have it, if they need tested, they took that from us so that people had a place to call. They also started a collection center, which helped us greatly because they recruited staff. They had, at that time, a lot of closures, so the dentists were closed, the optometrists were closed, so the initial volunteers were a long range of licensed professionals, optometrists, dentists, their staff, the chiropractors, and also their staff. The hospital worked with them as a team to do training and also the county found a collection site so that people could go to that in a place for the call center. Well, one of the biggest things that I've noticed is that usually if you have a disaster, county disaster, it's a short time period. This is something that just continues on, and to be able to keep having things in the agenda and to keep it as serious as it is, because it's certainly a deadly disease. They all still continue to meet, and as does the hospital, to try to now almost promote an awareness to the community to keep everyone safe. And if asked, has it made us stronger, or how has it made us stronger? My response to that is first is that just because there was nobody else, we had to be totally accountable for our hospital community. No one's going to come in and rescue us from this thing. Nobody else knew anything about it, so we were all we had to do this. That felt certainly a little isolation alone, where we had to solve this problem ourselves. Everybody took such tremendous accountability. We would struggle with the lack of because there's so much hard to find knowledge, but we made a decision that there's things we did know to do, so we started to separate the anxiety from the things we don't know to the things we do know to do it. For instance, the isolation rooms, how to get negative pressure into those rooms. We could figure those things out, so we went to action that way. Well, I got to think the self-awareness of the teams, a lot of emotions, a lot of fear. We really got to know ourselves well, and to be accountable for our emotions. I mean, there's times it was so frustrating, we just become, angry, but we would talk about that. Can't find supplies, being able to vent together as a team and then to move on. So it made us strong as a team, and from a sense of personal accountability to own our own emotions and to get past that, because there was no time to figure things out. We had to keep things moving. So also we learned to delegate a little bit more, because we we needed so many things going on at once, so the teams had the motto, proceed until apprehended. They would certainly bring things up to the Hicks team to be trialed, but a lot of cases they just knew that they kind of had to go ahead to make those improvements that need to be made. For instance, the doors, that was all done by a team to screen employees and patients, and each door has kind of a different role that they play, and there's still teams that actively are involved in that. You know, I think before our hospital was more hierarchical, not necessarily just out of habit, not necessarily from my demands that everything had to be approved from me, but it's just a habit. But we couldn't act that way, and so we're much more of a matrix system now, with teams being empowered to make decisions. And we continue on. It's not over yet, so I'm just grateful to the teams that we have and the people in our community. It just asks everybody to be safe. Now, just put my mask back on.
Very well.